I don't believe that postponing the implementation of some form of national health insurance would be responsible. As I said, we're working on the system overall. We have issues right now where people cannot access health care. In our private sector system, in private insurance, very often, if somebody has a pre-existing condition, if they want to buy health insurance, those pre-existing conditions are removed from coverage. In other words, if I go in to buy private insurance, I have a history, I have had a small heart attack or something, they insure me, but they will not cover any future incidents related to coronary heart disease. And so there's people out there who fall between the cracks, who cannot access health care, and I believe that that would be irresponsible. So I understand the concern, and I think it's important that private sector and everyone recognizes that legislation is something that's fluid. We can come with a proposal for NHI, we can monitor how it's working, how in reality, how it's performing, and if adjustments need to be made, adjustments can always be made. And if you make getting it perfect a barrier to ever beginning, I think, again, as government, that would be something that's irresponsible. They've referred to a deficit in good governance. The legislation has gone through its appropriate legislative track. It's gone through Council of Ministers, it's gone through SARE, it's gone through Council of Advice. Again, I think we've always tried to do things as responsibly and as transparently as possible. We've worked with all different stakeholders. We believe that a significant number of changes have been made to NHI, and I think it's important that people recognize originally, remember, this is actually a second term as government. Originally, in the first term, we had an instruction to finish the national health insurance by the end of 2016, right? But based on the discussions that we had and with the understanding that it is a complicated topic, this is not something that you can just piece together, and it's certainly not something that you can do without consultation from stakeholders. So because of that, we were given more time. We were given till the end of 2017 to finalize our plans. So we've made a number of changes, and these changes to the legislation are based on conversation with stakeholders. So I think when stakeholders say they're not sure if their viewpoints have been taken into account, I think that's grossly inaccurate, because enough of their viewpoints have been incorporated that the NHI legislation has changed to the point that we believe it's responsible to go back to the SARE and back to the Council of Advice for updated opinions. Again, I welcome the discussion. I think the dialogue is a healthy conversation, and it's something that I expect will continue for not only up until the debate with Parliament, but years to come. But remember, our goal as government is clear, that everyone should have access to quality health care. That's why we're working on a new hospital. That's why we're working on reforming our overall healthcare system. That's why we're working on national health insurance. And I think it's important that people recognize that financial barriers to accessing health care is as much of a barrier as a physical barrier. So if people cannot access health insurance that's affordable for them to be able to pay for the health services that they require, that is also a barrier to good health. And as government, we are committed to making sure that this is done both financially, sustainably, and financially realistically.
The problem with SHTA and their comments on NHI, the issues, the comments or problems with the SHTA and the NHI. It is not only today, but kind of quite some time now, the SHTA have been expressing themselves about this NHI and not in agreement, and other stakeholders also. The last press briefing held by the CFT, this was one of my questions about them, about the NHI. And basically the CFT said that they met with the SHTA to find out what their concerns were and why they were against it. And basically what the CFT is saying is that the government have not done enough to properly inform the SHTA. Seemingly there is a lack of information. They have not gotten enough information, one being that civil servant may get a better package than workers from the private sector. Have they ever relayed this information to you? Have you ever even go into trying to discuss personally with the SHTA and have a one-on-one meeting and clear up their concerns?
Thank you, Bibi.
Look, I still have very good relationships with the SHTA, and I would say, again, just to show how not divisive, how complicated, how emotional a discussion this is. This is a topic that's generated friction between friends, even. But I think that as one of the stakeholders, they are one of the most included in the discussions because they've taken the time to put their concerns on paper, and in general, they try to do their research in terms of putting backup and argumentation to their points. So I would not agree that they've not been well informed. Look, as we talk about that we need to make health insurance, the health sector more financially sustainable. Fact is, SZV currently manages 5 different funds under their administration. One of the points with NHI is that those 5 packages should be synchronized into one package, one set of rules, one set of terms and conditions. So instead of maintaining 5 sets of books, which has an administrative cost, which means you need human resources for it, maintain one set of books, right? So synchronizing into one fund, of which civil servants would be included in that. And so going forward, the discussion would be that government becomes an employer just like every other employer on the island, and that civil servants would become employees just like every other employee on the island. So the topic has been very clearly pointed out and discussed and in presentations explained.
National health insurance comes with a cost. Of course, when employers or SHTA or anybody here that their costs are going to go up because of NHI, you are going to get pushback. Because already at the level they are right now, it's problematic. It's a burden. But we all want, not that we want it, we have been instructed to have a national health insurance framework in place by the end of this year. That does not mean to say that there's going to be a debate by the end of this year. You got to take into consideration that Parliament has to pass it. Then you have to wait the 6 weeks for the ombudsman to see if any objections exist against the legislation. Then the Governor General will sign. So it's a very tight window that remains. The SHTA, who I met with also, is protesting and objecting against the high cost. If we have to use the same system we're using up to now, it would be unpayable and would create havoc. We have to think of ways of financing national health insurance differently than we've been doing it so far, by having employers and employees pay. And one of the ideas might be to have an indirect tax, as other countries have done, where you get your tourist population, which is much bigger than your local population, assist in paying for health care costs. It's also done with the environment. If we do that, that would bring about an alleviation, not necessarily a reduction. There might still be an increase, but at least the increase would not be at a level that it becomes unbearable and unpayable.
There's some things, for example, that we're working on already, and I agree wholeheartedly with the ministers just mentioned about indirect taxation. If you remember in previous press conference, I've mentioned that I believe that ultimately our healthcare system shouldn't be funded by tax on wages because the contribution base, as he mentioned, is too low. But already, as a first phase, we're looking at the possible implementation of something like a sin tax. So basically, a tax on cigarettes, so tobacco, alcohol, and I would like to include sugar soft drinks as well. These are actually working towards exactly what the minister and I are talking about contributions other than from the salary base, which would help to reduce the burden that would be paid by salaries. One other thing I'd like to point out, I've looked at, in preparing for this, a number of private sector insurance policies and plans. And very often what happens is, while the premiums are affordable, while the individuals are in their prime and working years, I've seen premiums that when people are 65, 70, reach as high as $34,000, $35,000, up to $40,000 a year, right? So what is a very possible scenario is that people who are making good incomes go through with private insurance, and by the time they retire, they say, wow, this is no longer affordable. Let me dump my private insurance and then come back now into the healthcare system, where if your contribution is based on income, your contribution is going to be negligible, but your expenses are going to be very high. So when the private sector looks at it, I think they need to look at it also from the entire term of what their cost is going to be, because it is government that is always the default for healthcare problems. Whenever anyone lets their healthcare insurance lapse, so if somebody has private insurance, they let it lapse, they get into a car accident, it's government that has the ultimate expense to air ambulance the people out, to pay for the medical expenses, because we have that moral right, obligation as government to do that, right? But those monies don't get recovered other than general taxation.
Now, health insurance is not really my forte, but I remember recently Minister Boseman signed a agreement with NAGICO for insurance for the justice workers. Is there a connection to it? Maybe you can let me know.
No. If you remember, last year also, we negotiated a package, in particular was geared towards the self-employed, towards bus drivers, taxi drivers. That was a very affordable insurance through private sector. But this was really more as an interim as we're working towards NHI, because there were some people that were claiming that they couldn't find affordable health insurance. So we tried to and negotiated an affordable package so that people have an option while we're working on this. So I'm not exactly familiar what the Minister of Justice signed for in terms of health coverage.
But just for correction, it was not Minister Boseman, it was during the term of Mr. Kirindongo, and it was aimed specifically towards uniformed personnel of government.
Thank you. We move over to Lyndon Brown of BCN News.
Good morning, Ministers. Minister Emmanuel. Of course, with the airport incident, a life have been lost. Some people will say that there's a sign there, and persons should not practice being at the fence. You said that you had some discussion through me, Mr. Bonkampo, and the plan gonna be fast?
No.
Thank you. We move back over to Bibi of.
After hearing what the Minister of Finance had to say, added to what you explained about the NHI and the complaints and etc. Not even so long ago, SZV said the private sector, there's almost 200 million in debts out there, and they have the ATS trying to collect these monies. I mean, if already the private sector is not paying, do you think if with the increase when the NHI comes in, they will pay?
First of all, I'd like to comment. I don't see it as complaints. I see them as concerns that, points of interest, points of concern. Again, I really would like to stress, I do not see this as a combative discussion. I see it as a very productive discussion. So I really don't want to label this as a tit for tat, a brawl in the media. Not at all. I think this is a topic that there's many issues that are of interest to the public and warrant a healthy discussion, right? So just to be clear. The point about compliance is a point that the ministers that we discuss on a regular basis. Compliance, because when we talk about compliance, it isn't only about tax payments, it's about labor laws, it's about environmental regulations, it's across the board, right? Anyone who operates a business not in compliance is not operating on a level playing field. And I believe it's government's responsibility to make sure that everybody is operating on a level playing field, paying the same amount of taxes. A company who does not pay their taxes has a huge competitive advantage over a company that pays their correct share of taxes. So, and again, it goes back to the earlier discussion about government's contributions. If you make compliance a criteria to making progress, then will you ever be able to make progress? I doubt it. So you have to make your plans going forward, and parallel to that, you need to work on compliance. And I can assure you from Council of Ministers, the topic of compliance is something that we discuss on a regular basis and something that we're very committed to working on. So we recognize there's money on the street that needs to be collected. We recognize that there's companies that are grossly negligent in terms of complying with the law, and that's government's responsibility to streamline that, and we are working on it seriously.
Andrew?
Yes, Minister Emmanuel, Backstreet, any update on it? We haven't heard in a while.
That's a strange question. The proof is in the pudding. If you walk on Back Street, you would see the extension now passing the cadastre office and going down much further, and the work is commencing very well. There have been some setbacks, and that's due to heavy rainfall, but I think the work is progressing well, and very soon you will see the third phase, which would be after the Newness and them house, going down, passing, can't remember the name of that area, but soon you will see the third phase, or the fifth phase. Yeah, the fifth phase going down much further. But I think the work is progressing pretty well.
Mr. Brown?
Mr. Lee, on the basis of health care for all, how it will be possible people who are not documented? Because these days, a lot of time when there is an accident, the person haven't documented. When they go to the hospital, they have to pay a fee before they can be attended to. How is this possible that the same question, persons who are not documented, come in that bracket?
As I mentioned, NHI is full of many choices to be made. To first of all clarify your question, if somebody who's undocumented arrives at the hospital or for non-critical care, they are asked to pay. If they have a critical, life-threatening situation, they are always provided treatment. If they need to be evacuated, they're always evacuated on humanitarian grounds, humanitarian reasons. Going forward in NHI, and as our system is right now, if an undocumented worker is employed in a business, that business is, I guess, actually obligated to pay their taxes, and they pay their premiums to SZV, and that undocumented person can receive coverage through SZV. Going forward with NHI, it is a discussion point as to whether undocumented individuals should still be able to access NHI, access health insurance. So this is exactly one of the points that's up for discussion about why should we continue with that practice that undocumented receive health insurance. As a matter of fact, I'm going on a limb here, but even there's a discussion with new documented but immigrants, whether there should be a waiting period before they enter our healthcare system, whether they should purchase private insurance for a period of time before entering our healthcare system. You know, we're a small island, limited resources. We need to guard those resources fiercely. We need to be sure that we are taking care of our people. And if people are coming in from abroad for, let's say, a one-year work contract and have serious medical conditions that government is obligated to pay, it has a consequence. I'm not making a judgment right or wrong. I'm just saying these are discussions that are taking place that we need to finalize.
When you spoke about what happened with the sewage truck on the dump, the videos, a possible court case, you also said that, listen, I did not react right away. Did you have to investigate to get this information so that you can at least put out that information earlier and stop those people that is harassing the sewage truck driver who was actually providing a service for government?
Yes, it took some time for us to get the full scope of the situation. I knew that work was being done in the Belvedere Dutch Quarter area. Which truck or which individual or company doing the work, I did not know. So it took us some time to really get the full brunt or the complete detail of what happened and what was going on, and the details. The thing is, the operator now in the company have filed a complaint, and in that complaint they're asking for an apology from the individuals that filmed and posted the video, and if not, then we can look at a possible court case. I think that apology should come from the responsible authority, which is the minister, and that apology they will get. I've tried reaching out to the individuals that was involved in the situation. It haven't gone as smooth as I thought it would have gone. However, some are cooperative and some are not. And I can understand the concern of the operator, because now they want to know if they were doing something wrong when they were given a task by government. So it is something that we are looking into. And again, I think, yes, an apology is deserving to the individual, and I will do that.
Okay, last week you mentioned that St. Martin received 80 million guilders, if I'm 8 million guilders. Okay, do you have any designation, different area in St. Martin where this money is going to be helped?
Yeah, I think that question also came up. And I said that the 8 million guilders was projected in the 2017 budget as one of the items that in revenues to receive to be able to make the 2017 budget balance. So it's not like you have it as an extra money in your pocket to go and spend on roads or bridges or whatever else. No, it's in the operational expenses that was projected in the 2017 budget. So we could tick that off of having been received.
We will now move over to our final round of questions. Bibi?
Yeah, thank you, Giselle. Minister Emmanuel, can you give us an update on two foundations, two entities that you've been working on? One being the St. Martin Housing Development Foundation. Are you moving forward? Are you getting anywhere with getting the board members you asked to make their post available? And did you, the post on the GEBE Supervisory Board, was that finalized, and is the person now officially on the board?
I would take the question from the latter to the front. Yes, the person that was appointed by government was Benvenido Richardson. He has been appointed. Tomorrow, a meeting will be convened by the shareholder to have it officially done. But yes, that we have reached to fill in all the positions on the board of GEBE. So yes, to your question, Benvenida Richardson has been the individual chosen for that seat position on the board of GEBE. And then coming to the housing, yes, also I have received indication from a number of individuals that they will tender their resignation, and this can happen as soon as next week, which is a good thing, which is a step in the right direction. There will be some shifting amongst board members, but at this present moment, I wouldn't say I am comfortable as yet, but I'm willing to go along with the decision and the position that have been made available by some of the individuals.
I can remember the days when Emilio was alive. There was a well that Mr. Elwaldo Richardson used to wet his produce, and now I went and checked the well. It is empty. Do you aware of what might have happened to the well? Also, I saw that beneath the well, there's a pool of water. So that well used to be very filled with water, but now it is empty. Did you, your office, anybody from VROMI look into that? Because I believe it should be a monument.
Okay, all right, I'm a bit lost with the direction that you're going with the question. However, anything that pertains to monument and Emilio Wilson, it's the competent of the Ministry of Education, Culture, that deals with monument permits and deal with monuments on the island. But it's a question that I would have to find out more about. In her absence, I am also taking up the position as minister. But I'm not too aware with what you're talking about with the well. We have had discussions with Rainforest, who is occupying the land in Longlease, with the park that is there at the present moment. We have also had in-depth conversation relating to the monuments. Jay Havisa has identified all the monuments. I don't remember a well coming up in our discussions, but it's something that I can look into, because you said you have been there and you have seen it. It is something I can look into, and I can probably send you the answers to whatever I receive concerning that situation that you're talking about. But knowing about a well and what is being done with it, I don't know at the present moment, but I can get that information.